First, I'm going to wash my hands for 30 seconds. Okay, now I'm going to go clean my stethoscope, the bell, and the diaphragm for 15 seconds. A alcohol swab. Throw that in the garbage. Right now I can enter the patient's room, so I'm going to knock. And provide patient privacy and do hand hygiene. Hi, how are you doing today? Good. My name is Lindsay. I'm going to be your nurse. I'm just going to be doing a head-to-toe assessment. Can you go ahead and give me your name and date of birth?
Melena Yoni, 12/18/97.
Okay. And do you have any allergies, Melena?
No.
Okay, perfect. Do you know where you are today?
The School of Nursing,
Okay, and what day of the week it is?
Wednesday.
Okay, patient is alert and oriented ×3. And I see that you were admitted for vomiting, nausea, and diarrhea. Are you experiencing any pain with that?
Yes.
Okay, where's your pain at?
It's like right here in my stomach.
Okay, and can you describe the pain for me? Is it aching, dull, throbbing?
Dull.
Dull? Okay, and when did the pain start?
Last night.
Last night. And does anything make it worse, make it better?
Kind of like curling up in bed makes it feel better.
Okay, and has it prevented you from doing any daily activities?
Not really.
Okay, perfect. And on a scale of 1 to 10, if you had to rate your pain, 10 being the worst pain you've ever felt, what would it be?
Like a 2.
A 2? Okay, perfect. So I'm just going to go ahead and lift your butt up so we can begin our assessment today. Patient is lying comfortably in bed. Her facial expression is relaxed and content. She's making eye contact with me as we're speaking. Her speech is fluent, understandable, and clear. The content of it is appropriate for the situation. She appears bathed, like her chart says she was bathed last night. I see she's not connected to any IV, oxygen, or a catheter. And if you could go ahead and pull down your lips so I can look at your gums. And the patient's oral mucosa is pink and moist without any lesions. Okay, perfect. So I'm just going to put this down. I'm going to start with vital signs. Alright, I'm just going to have you put this underneath your tongue and keep your lips pursed and closed until it beeps, then you can go ahead and take it off, okay? Alright, and I'm going to put this on the patient's left finger, and then I'm just going to count your pulse for about a minute, okay? And I'm going to palpate and count the radial pulse for 30 seconds, and then switch my gaze to respirations to count for 30 seconds as well. Right, patient's pulse strength was a 2+, and it was 60 beats per minute. The respirations were 14 breaths per minute. I can go ahead and take these for you. patient's temperature was a 97.9, and the pulse ox, the O2 saturation was 98%. Right, now I'm going to take your blood pressure, so I'm just going to, is it okay if I lift your head up?
Yes.
Okay, perfect. You could just lift your arm up for me so I can slide this cuff on. Okay, I'm going to make sure it's not too tight, but tight enough. Alright, patient's blood pressure was 114/78. Does that sound pretty normal? Okay. Okay, now I'm going to begin my neuro assessment. Patient has been able to follow all commands and directions so far. Okay, so the first thing I'm going to do is check your pupils. I'm just going to have you stare at my nose, and I'm going to shine this light into your eyes, okay? Okay, patient's pupils are 4 millimeters bilaterally. Right, and they are equal, round, and briskly reactive to light. So we know that cranial nerve 2 and 3 are intact. Okay, if I can have you raise your eyebrows and smile for me. Okay, so we see that cranial nerve 7 is functioning properly, and could you swallow for me? Okay, perfect. Cranial nerve 9 is also functioning properly. All right, I'm going to have you squeeze both of my hands at the same time. Right, upper extremity muscle strength is the 5+, so no signs of muscle weakness on either side. Okay, now I'm going to take a look at your legs, so I'm just going to lift the bed sheets up real fast. Right, and I'm going to put on some clean gloves. First, I am going to check for pretibial edema. I'm just going to palpate down the patient's shin. Right, and there's no edema on either side. Right, and I'm just going to have you push on my hands like gas pedals. All right, lower extremity muscle strength is a 5+, so no muscle weakness on either side. Now I am going to palpate for the pedal pulse. Right, the pedal pulse is a 1+, so that's normal. Right, I'm finished with your legs, so I'm going to go ahead and put your sheets down and take my gloves off and do hand hygiene. Right, so now I'm going to begin my assessment of your heart. So I'm just going to press on your nail bed to make sure your circulation's okay. Right, patient's capillary refill is less than 2 seconds. As I'm feeling the patient's skin, it's warm, dry, has a pink color, no edema or any lesions or abnormal dressings are present. Okay, so now I'm going to listen to your heart. Is it okay if I pull down your gown a little bit? Right, patient has a regular heart rate and rhythm, and I identified S1 and S2 respectively. Now I'm going to oscillate for the apical pulse at the 5th intercostal space on the left midclavicular side. So first I'm just going to feel for that. I might have to go under your sports bra just a little bit, if that's okay.
Yes, that's fine.
Okay. Right, now I'm going to palpate for the radial pulse. Alright, the apical and radial pulse are symmetrical, so that's good. Right now I'm just going to go a little more medial from the apical to see if I can palpate the PMI, and it is not palpable. Okay, so now I'm going to listen to the patient's lung sounds. We see that the patient's breathing is unlabored. Okay, so I'm just going to listen to your lungs. Each time I place my stethoscope on your skin, just take a big deep breath in and out. And if you feel lightheaded at any point, just let me know, okay?
Okay.
Perfect. Alright, anterior lung sounds are clear with no adventitious sounds present. I can go ahead and have you roll over on your left side so I can listen from your back. Okay. Deep breath. Alright, posterior lung sounds are clear with no adventitious sounds present. I can go ahead and check the patient's back to see that there's no skin breakdown. Alright, Melina, I'm just going to pull down the top of your pants just so I can visualize your tailbone. Alright, and we see that the sacral area has no skin breakdown as well. Okay, you can go ahead and roll back over and put your gown back on. Alright, and now I'm going to do my assessment of your abdomen, so I'm going to pull down the blanket. If you could just pull up your gown so I could visualize your stomach. Okay, perfect. I'm just gonna fix that. And can you show me where you've been having your pain?
Like right here.
Okay, cool. And when was the time of your last bowel movement?
A couple hours ago.
Okay, and was it solid or still kind of running?
Solid.
Solid?
Yeah.
Okay, and have you been urinating regularly?
Yes.
And able to keep solid food down with no vomiting, nausea?
Yes.
Okay, perfect. And I see that the contour of the patient's abdomen is flat. So now I am just going to listen to your bowel sounds. This stethoscope might be a little cold, so sorry about that. Start here. Alright, bowel sounds are active in all 4 quadrants. Right now, I'm just going to press on your stomach in all 4 quadrants, making sure to do your left side last, because I know it's been hurting you a little bit. Alright, I'm going to do that one more time, just a little bit deeper. Alright, patient's abdomen is soft and non-tender to palpation. Alright, you can go ahead and fix your gown, and I will put your sheets back up. That is it for our assessment today. I'm going to go ahead and lower your bed back down. Did you want to keep your head up?
Yes, please.
Okay, perfect. Do you have any questions for me before I leave?
No.
Okay. And I'm going to make sure that the brakes are locked and put the side rail up. And I'm leaving your call light in reach, so if you need anything while I'm gone, just let me know. But thank you for your time. Okay, I'm going to hand hygiene out. And I would leave the patient's room. My name is Lindsay Pikulinski. I took care of patient Melina in room 1212. I did a head-to-toe assessment with no significant findings. Patient was admitted Friday night for nausea, vomiting, and diarrhea. She was given IV fluids for dehydration and nausea medication. After my assessment, I found that all vital signs were within normal ranges. Patient did report pain in her lower left quadrant. She rated it a 2 on the pain scale. The IV meds have been stopped. She hasn't had vomiting or diarrhea in the last 12 hours and is able to keep solid food down. I recommend that she be discharged and just participate in a few days of rest until abdominal pain has subsided. Thank you.